Hi, my name is Natasha Andrews, and I'm here today to talk about a bilateral breast reduction. Excuse me. I recently had a breast reduction on August the 4th, which is Friday. Today is Tuesday, and surgery took about 3 hours. Altogether, everything took about 6 hours, 5 to 6 hours, with me leaving pre and post. But before all of that, I wanted to speak a little bit about my decision to have the breast reduction. If anyone's thinking about having it, I say definitely go ahead and do it. It's very important that if you are experiencing any pain in your lower back, upper back, your shoulder area, and you find yourself removing your bra straps like I was doing, it's probably something that you should consider. I would say see 2 doctors to get 2 different, opinions and take it from there. I did see one doctor that did the procedure as the anchor breast reduction, and he actually referred me to another doctor that actually does the procedure as the bilateral breast reduction. The first doctor that I saw initially spoke to me about the anchor breast reduction and said that he did not want to scar me up. He felt like the anchor breast reduction left a lot of scar tissue because of the way that it is performed. And being a darker skinned woman, not knowing how my body heals, that could lead to some scarring, scarring left behind and dark marks. So he referred me to another doctor that only did the bilateral breast reduction, which only leads to one type of incision. That's from the nipple and down. So after seeing both doctors, I decided to go with the one doctor that only did the bilateral breast reduction, which was a really good decision. I'm so happy that I went with that doctor, because after reviewing a bunch of videos on YouTube and seeing a lot of other young ladies who had the reduction done, who has the bilateral breast, who has the anchor breast reduction, a lot of them say that they're unable to lift their arms, and that's because of that incision that goes way back under the arms, all the way under, way up in the middle of the chest. I don't have that incision. I don't have any of that done, so I just have the incision from down up. And a lot of them spoke about how their breast bottoms out after it settles in and takes form. Well, my doctor informed me that that won't happen with my breasts after my procedure, because of the simple fact that he did not perform that type of procedure. He said it actually is going to look like I had implants done, because after the procedure has been done, once my breasts take form, once they actually do the incision, remove everything, and then tighten the skin back up and pull it together, they're going to look like I had a lift. They're going to look like I had a lift and also implants. If you didn't know me before, you probably think I had implants done, but if you knew me already, you know that I had huge breasts. I'm coming from triple D to a C. I probably was an E, because my bra size began to become smaller prior to my surgery. So leading up to my surgery, my pre-op appointment, I met with my nurse. We went through a lot of documents that I had to review, initial, and sign off on. My nurse provided me with those documents. She also provided me with some wipes to wipe my body down with prior to my surgery and to use after my surgery. She also provided me with my prescription that was written from my doctor. I was prescribed 4 different meds. The ones that I had to take 3 hours prior to my surgery, and the rest I had to take afterwards. One for pain, and the other one is for, I assume, inflammation, as well as to not get any, I think it's amoxicillin, to not get any bacteria backed up into my breast or anything like that, any type of infection, things of that nature. So she provided me with that. She talked to me as we went through the documents to assure that I was aware of everything, to not eat past midnight, to not shower that morning off, to only shower at night, to make sure that I wipe myself down prior to coming into surgery, to also not wear any deodorant, not wear any makeup, to make sure I wear loose-fitting clothing or comfortable clothing, slip-on shoes, and to make sure that I did take my meds 3 hours before and get enough rest, and to be on time and things of that nature. She also informed me to, if I did drink anything, to make sure that it was only clear fluids, of course, like water, the day of surgery. And I assume that that's because just in case you throw up, you're only throwing up, you know, clear liquids, and you're not throwing up, you know, food and things of that nature. So, but I want to speak more about the bilateral surgery, but I also want to provide photos and videos. I have an animated video that I want to upload and provide that as well, pertaining to it. That way a lot of people can see how that procedure is done and maybe consider going with the bilateral breast reduction versus the anchor breast reduction. One thing I do like about the bilateral versus the anchor breast reduction is that there's less cutting, less incision, less scarring. You still have your mobility. You're able to move your arms. When I came home from the hospital that same day, the next day after resting overnight, I was in the kitchen. I was cooking, and I know they say take it easy and things of that nature. I did rest a lot, but I was able to, you know, put some potatoes in the oven. I steamed me some broccoli. I cut up some fruit. I, you know, watched movies and I relaxed, but I was still able to move my arms and things of that nature. It was a little sensitive under my arms, but I was still able to lift my arms and move about, and still able to comb my hair and do whatever I wanted to do with my arms. So it didn't stop me from doing that. And from what I understand, with the anchor breast reduction, you're not able to really lift your arms that high. You know, a lot of women are saying that they can't do too much with their arms or the upper body because of the fact that the type of surgery they had. And my doctor did mention not to, you know, lift anything more than 10 pounds. I don't have a reason to lift anything, you know, more than 10 pounds now that I'm just home, just relaxing. But in an event that I decide to move some furniture around or anything like that, I know not to lift anything more than 10 pounds. But I know that if I did, it would only be just this area. It wouldn't really affect this area at all. Now, 2 weeks prior to my surgery, I did work out a lot. I ate very healthy. I ate a lot of fruits and vegetables, grains, and things of that nature, so that I can heal faster. I think a lot of what you put in your body is what you get out. Once you're going through something, like your body goes through a traumatic stage of something like surgery, it all helps with that healing process. So 2 weeks prior, like I said, I worked out vigorously, and I also started eating a lot of plant-based foods because I know it's much healthier for you, and it does help you with the healing process when it comes to anything. I also know that ginger is really good when it comes to healing. So I've made me some lemonade with ginger, some peach drinks with a little ginger, and as I made a lot of my own homemade juices and you know, natural foods that are from the ground, foods that are, you know, that are plant-based, like I said, to help me heal better. I did a lot of reading on natural foods that actually help with the healing process of anything that, you know, that you may be going through, not only just surgery. The day of my surgery, I woke up that day. Everything went so fast. I woke up that day. My sister was knocking at my door, and I got up, and she was like, "You're not ready?" And I'm like, "Yeah, I am. I'm ready." So I just had to, again, wipe myself down with the little wipies and put some loose, comfortable clothes on. My surgery was scheduled to be at 12:45. We got to the hospital at 10 o'clock. You're supposed to arrive 2 hours prior. So I wanted to be early, but as soon as I got there, I checked in at the nurse's station. At the receptionist station, and then we went into a waiting room, and I was there for like 10 minutes. And after sitting there, they called me back immediately, and then I got changed, and I was in, you know, the pre-operation room, and is where me, my sisters, and my nieces kind of hung out, watched TV. We played hangman. We quizzed the nurse. We asked her a bunch of questions. I met with my